Adverse childhood experiences is incredibly important to the work at Children's Trust because we're focused on preventing child abuse and neglect and unintentional injury. And we know that there's a lot of ways to come at that, whether it's program, policies, partnerships, both at a community and a state level. And so there's really a tremendous opportunity with the new data that we're getting in our state to take a look at how we are going to be targeted with those programs, services, and policies from this new ACEs data. And policies, a wonderful opportunity to take a look at how we can go about improving the lives of South Carolinians all across the state.
Well, there are really three important points of the ACE study. The first is that it identified that ACEs were common. So no matter who you are or where you come from, ACEs are a part of children's and adults' lives. The second is that they're interrelated. So if you have one ACE, you're highly likely to have another ACE. And the third is that ACEs are intergenerational. So we're not only seeing families impacted, but they can actually pass on that impact to the children that they have.
There are opportunities to take a look at how we go about funding our prevention services in our state, how we go about making our organizations and state agencies collaborate around prevention, and all of that really provides a nice platform then to take a look at how those outcomes are produced later on in life.
South Carolina is the 5th state ever to receive the ACE Interface Master Training Program. And it's been fantastic for a great reason. One is that we're ahead of the curve, but the other is that we've been able to lean on other states to get their lessons learned and apply that to our work here. So we've been very successful so far because we're in a great spot to not only support this work, but to learn from the few others that have gone before us.
So it's an opportunity to take that data and say, what sort of programs do we currently offer? Is it home visiting? Is it strengthening families programs? What is it that we're currently doing that is having a tremendous amount of an impact, but it's something that needs to go to scale, and it needs to go statewide, and it needs a public-private partnership in order to make that happen.
What we want to be able to do is use ACEs to reduce and prevent child abuse and neglect. But we know that child abuse and neglect is related to a lot of other things. So ACEs provide us with a great opportunity for us to collaborate and convene with our partners so that we can not only prevent child abuse and neglect, but prevent other issues that keep children in our state from thriving.
ACEs and the prevention of ACEs are a winnable issue. And that's an incredibly powerful component when we look at working in the policy arena and wanting to have those issues that are something that's going to be achievable, but then something that's going to really resonate and have a tremendous positive impact on the lives of families and children in our state. And I think ACEs provides that opportunity to address a lot of issues simultaneously, and again, really turn things around for children and families in South Carolina.